prevention of stroke. So we'll do this presentation in about 40 minutes, and then we'll have enough time for question answers. So what is stroke? Stroke is a sudden event that occurs when a blood vessel that takes blood, oxygen, and nutrients to a part of the brain is either blocked or bursts. When the blood vessel is blocked, we call this ischemic stroke. When the blood vessel bursts, we call this hemorrhagic stroke. So these are the two basic types of stroke, ischemic stroke and hemorrhagic stroke. Now, what is the burden of a stroke? It is the second leading cause of death worldwide, all over the world. In the United States, it's fifth leading cause. Someone in the United States has a stroke every 40 seconds, and 2 million brain cells die every minute during a stroke. So if you look at the stroke, everybody age 25 years and older, the risk is about 25% in their lifetime. And it's a little higher in female as compared to male. Now, if you look, the annual incidence is about 800,000 strokes annually. And majority of them, they are first-time stroker, about 3/4. But 23% strokes can be recurrent, means they already had one stroke, this is a second stroke. So once you have first stroke, your chances of second stroke also go up. So very, very important point to remember. It's not only you get stroke only one time. Once you have a first stroke, the chance of second stroke is almost 1:4. Now, to understand stroke, we need to know some basics about the brain. So if you look at the brain, there are 4 lobes. This red one, it is called frontal lobe. And it's very important for emotions, problem solving, speaking, motor activity, reasoning. The second is parietal lobe. Parietal is good to know right from left, sensory feelings, reading, body orientation. And then this blue is your temporal lobe. It is very important for language, especially on the left side. It also controls your behavior and hearing. And then the green one, it's occipital lobe, which is more for vision and color perception. Now, the old brain is a cerebellum, which is involved with balance and coordination. And then the brain stem, which is involved with breathing, body temperature, digestion, swallowing, and sleep. So all the brains, they have different functions. So this brain is new brain, this brain is old brain. And if you look at the brain is supplied by 4 arteries main. There are 2 arteries, these are internal carotids from the sides. And then there are 2 in the back, we call vertebral arteries. And then they have different branches. So when we talk about stroke, we need to know where did the stroke occur and which artery is involved and which part of the brain is involved. Now, if you look at the pathophysiology of stroke, it's an abrupt neurological outburst caused by impaired perfusion through the blood vessels to the brain. And blood flow to the brain is managed by 2 internal carotid arteries and 2 vertebral artery posterior. So, again, these are the 2 posterior arteries, and these are the 2 interior arteries. And then there are many branches, anterior cerebral artery, posterior cerebral, then communicating, a lot of branches here. Now, broadly, if we look at the stroke types, there are 2 types. One is ischemic and one is hemorrhagic. Now, ischemic strokes, they are the majority of the strokes. They are about 87%. Okay, so majority of the strokes, they are ischemic. And as I said before, they are caused by deficiency of blood and oxygen supply to the brain. Now, there are 3 types of ischemic stroke. One is thrombotic, which are the majority of the cases. It is due to a narrowing of the blood vessels due to atherosclerosis. So as due to aging and many other factors, there's a buildup of plaque, which will eventually constrict the vascular chamber and form clots, causing thrombotic stroke. Now, the second type of stroke is something called embolic, whenever there's a blood clot or other debris, let's say from heart or other parts of the body, they travel to the brain and they cause a clogging of the arteries we call embolic stroke. Most of the time they occur from the heart, but sometimes there can be clotting issues with the blood too. Now, this third type of stroke we call lacunar infarct. Lacunar infarct means very small stroke. And they mostly occur in parts of the brain called basal ganglia, pons, cerebellum, thalamus. And typically they cause very little damage and they are not that serious. Most of the time patients have very good outcome with the lacunar infarcts. So this is hemorrhagic stroke. As I said, only 13%. Now, out of 13%, majority of them, 10%, we call intracerebral hemorrhage, which is typically due to high blood pressure. But sometimes it can be due to other disorder like amyloid angiopathy, use of blood thinners, smokers, drug users, mostly hypertensive, right? Now, the second is something called subarachnoid hemorrhage, which is 3%. And these are the patients who have sudden onset of worst headache of their life. They can lose consciousness, they're vomiting and vomiting. And these people can be due to burst aneurysm or AV malformation, or sometimes it can be traumatic too. So this diagram tells us all types of strokes. So this is ischemic stroke, and this is hemorrhagic stroke. Now, ischemic stroke, if you see, this is artery, and there's a buildup of plaque. So this is thrombotic. And this embolic, there's a clot already, which is blocking the artery, so it becomes embolic. Now, in the hemorrhage, you see intracerebral hemorrhage, the blood vessel ruptures, and the blood seeps here. And in the subarachnoid hemorrhage, the blood vessel and the blood comes here. Again, different types of stroke in diagrams. Same thing with hemorrhagic stroke and ischemic stroke. Now, if you see both the stroke, they're causing damage to the brain. In the hemorrhagic stroke, the blood seeps into the brain and cause dysfunction. In ischemic, because of the blockage, the brain area which is supplied by that artery does not get blood and nutrition, and those cells die. So that's a basic mechanism of these two types of strokes. Now, this slide is important to understand. So remember what I said, majority of the strokes, they are ischemic, 87%. So let's say this is the clot sitting here. Now, this is the artery which clot is supplying. Now, this whitish area, this is a dead area we call infarction. This is dead. But the surrounding area we call penumbra, which is a little darker, it is still live and it's salvageable. And if we don't do anything, this can also die out. So that's why it's very important to keep in mind, stroke is time-sensitive medical emergency. If you reach hospital in time, they can do either a medication or procedures to save the brain. So again, same concept here. If we reach hospital in time, there are two options. Either we can use what we call thrombolytics, which are either IVTA or TNK. And if you reach hospital within time window, 3 hours from onset, and in some patients close to 4.5 hours, we can give an injection we call TPA or TNK. And what it does, it goes to the brain and it dissolves the clot. So this area which was penumbra, it may be saved and it gets cleared up. So that is very, very important to understand. So when you have an acute stroke, it's very, very important we go to the closest stroke center. Now, what happens if you don't reach there in 4.5 hours, or if you are not a candidate for that medication? Then what we call is endovascular therapy. Endovascular therapy means there's a neuro-IR doctor who's trained in these procedures and who can go in through the groin and put a catheter to the artery which is blocked. Now, artery has to be blocked. So in those cases, ideally in 6 hours, but up to 24 hours. First option is they can put the catheter up to the artery and give the blood thinner locally to dissolve the clot. So that's very easy, right? So it's called intra-arterial thrombolysis. Now, second option can be they can put the wire there and go inside and try to break the clot. Again, that's also can be done. The third, there's a device called Mercy device. It can pull the clot back. Again, there's another technique called penumbra aspiration. And then the last one is stent. So all these procedures, they are done in the real time. My stroke center is thrombectomy capable. I see these miracles happening every day where a surgeon goes in and remove these clots. And if you look at the outcomes, can be life and death situations. So this is one of the arteries which is blocked. So you see, I don't see anything here, right? No, the surgeon goes in and they put a stent here. And once the blood flow is established, you see the whole artery come back. So between this picture and this picture, you see this artery is not visible because blocked. But once we put the stent in, this all come back. So that is the power of modern medicine. Very, very eye-opener. When you see one or two cases like this, it becomes like a miracle. And you start feeling like, this is really cool stuff. No, there's one more term which everybody needs to remember. It's called TIA, or minor stroke or transient ischemic attack. And what it means is the symptoms from the stroke, they last less than 24 hours. So majority of the time, 1 or 2 hours. Usually this is a harbinger of a full-blown stroke. And it's a warning that a major stroke is likely to occur. Up to 5% of patients with a TIA may have a major stroke in 2 days and 10% within 3 months. So that's pretty high number. 1 in 10 will have a major stroke in 3 months if we don't do anything. Approximately 15% of all strokes are preceded by a TIA. And among patients treated for a blockage-related stroke, 7 to 40% experienced a TIA first. About 1/3 of the patients who have a TIA go on to have a more severe stroke within 1 year. So message here is, when you have a TIA-like symptom, don't ignore it. They are not harmless. You should go to the emergency room and do a full workup and at least do the treatable risk factors. I can tell from my experience, about 80 to 90% risk factors are treatable and they can be taken care. So again, how do we know a patient has a stroke? So there are some mnemonics. We give it to the patients to remember, or public to remember. Now, few years ago, we used to remember something called FAST, F-A-S-T. Now, lately, we are using something called Be Fast. You have to be really fast, right? So it's called Be Fast. And in Santa Clara County, Be Fast is used by our EMS. And the reason is, if you use only fast, you can miss some strokes. Be Fast is more comprehensive. So if you don't remember anything from this presentation, please remember, what does the Be Fast stand for it? It will help everybody down the road, the whole family. So the B stand for balance, E for eyes, F for face, A for arm, S for speech, and T for time. Be fast. So I'll go through one by one. So the balance is, watch for dizziness, loss of balance when you walk, or difficulty walking. You're feeling dizzy and you're ataxic, and you feel like a drunk. So that is the balance part. Second, check for vision, for eyes. So either vision is blurry, or you're seeing double, or you're not seeing one part of the vision. So that can be a symptom of the stroke. The third is face. Ask patient to show me your teeth, smile for me, and one side is crooked. Most of the time, it's the lower face, not the upper face. If you have weakness in both lower and upper face, it can be Bell palsy. But if it's a lower face, it's a more sure sign of stroke. Next one is speech. So listen to the speech of the patient. Is speech normal, or is it slow or slurred? Is patient confused or patient is normal? It can be anything. So again, speech is again a very, very big symptom of the stroke. People can be completely confused. They may not be making any sense, or they may be very slow, or they may be very low. These are all subtle signs of a stroke. And time is tissue. So every minute counts. Moment stroke symptom start, you need to time it. And if you see, this is a graphic representation what goes on in the brain. Now, in 10 minutes, the red means dead tissue, and this greenish means this is penumbra, this is salvageable. So we still have a lot of salvageable tissue. In 1 hour, the dead tissue has increased and the salvages has decreased, but still 50-50. In 3 hours, again, maybe like 60-40. And in 6 hours, majority of the brain dies. So again, the moment you start the symptoms, you start counting and call 911. Don't drive yourself, call 911 because they have all the tools and they will take you to the appropriate hospital depending upon your symptoms. If patient known well is known within 4.5 hours, we can give what we call thrombolytics. If it's more than 4.5 hours, we still have many options. So don't ignore it. Go up to 24 hours, we can go to the hospitals. Now, what are the long-term effects of stroke? As I said before, stroke is the 5th leading cause of death. And it is also the leading cause of long-term disability in the United States. 50% of stroke survivors are left with one-sided paralysis, whether it is left or right. Patient cannot lift their arm, they cannot walk, they have difficulty swallowing. 30% are unable to walk without assistance. That's quite a big number of patients. Now, 26 have so bad strokes that they depend upon others to do activities of daily living, like bathing, eating, drinking, everything they need help. 19% have difficulty with speech. Now, one other thing very, very important, and as a doctor, sometimes we don't pay too much attention, depression. About 35% patients have depression, and unless we probe further, we don't get it. And the reason is, it's a life-changing event. People get sad, they are tearful, they start thinking negative. So it's very important to recognize depression and treat it appropriately. That helps with the recovery. And 1/4 of the patient, they can't live with the families. They are in nursing homes after stroke. So stroke has quite a bit devastating effects. And if we can prevent it, that's the best. Now, again, same, what are the effects of the stroke? Damage to the right side of the brain will cause paralysis on the left side of the body. It can cause vision problems, behavioral changes, and memory loss. And damage to the left brain will cause paralysis on the right side of the body, speech, a language problem. And the reason is left-right is important to know because your right side of the body is controlled by the left side of the brain, and the left side of the brain controls and vice versa. Now, the language is always, most of the patients who are right-handed, about 85% of the patient, they have language on the left. And if you're left-handed, majority of them, 50-50, can be either. So if you go to any neurologist, the first thing they ask you is, which hand you use for writing, and that helps us to localize where the problem is. Now, again, when you have stroke symptom, please don't call your primary doctor. Please don't call your neurologist. Call 911. because these are all medical emergencies which are very time sensitive. If you reach hospital in time, it can be, question of life and death. So please call 911 and go to the nearest stroke center. We call them brain attacks. Just like heart attack, we have brain attacks. Now, let's come to the risk factors. This comes in prevention. Now, there are few factors which we cannot be controlled, and there are few factors which we can control. Now, about 10 to 15% we can't control, and those are age. As we get older, our chances of stroke keep on increasing, and most of the strokes, they occur after age 55. Now, if you have a positive family history, there's a chances you will have higher chances you will have a stroke, and it's more for immediate family member. Now, this has more to do with genetics. Race and ethnicity. Black people, South East Asian people, including Indian, Chinese, and Hispanic, they have a higher prevalence of stroke and higher death rate from stroke than any other groups. Now, genders, before menopause, women have less risk, but after menopause, they have a little bit higher risk than men of the stroke. Now, if you have a previous history of stroke or a TIA, it increases your chances of next stroke. So remember I showed that slide about 1/3 to 1/4 of the strokes are recurrent strokes. So if you had a TIA, 1 in 3 more likely to have a stroke than someone of the same age and sex who has not. If you have a stroke, it means you're at greater risk for another stroke. Almost 1 in 4 will experience a recurrent stroke in the next 5 years. So again, once you have one episode, the chances second episode are high. Now, these 5 factors we can't control. Once they occur, right? So age, family history, race and ethnicity, gender, and previous. Now, what is in our hand is rest 80 to 85% of the risk. Now, if you want just one thing from today's lecture, how to control high blood pressure. This is the most important risk factor for stroke, both ischemic and hemorrhagic. And if we control it, you can certainly decrease chances of a stroke by at least 30, 40, 50%. Yeah. Now, how does it do it? High blood pressure, it causes atherosclerosis. We need to keep blood pressure around 120 to 180. It can be a little bit low, it can be a little bit high, but not too much. Now, if you look at diet plays a big role. And there is a diet named DASH, the DASH. It stands for Dietary Approaches to Stop Hypertension. If you adopt DASH diet, you can decrease your risk by 20 to 30% just by this special diet. Now, not only decreases your hypertension, but it also helps in many other ways. Now, it emphasizes a balanced intake of nutrients that are known to help regulate blood pressure, such as potassium, calcium, and we limit the sodium. So fruits and vegetables, lean proteins, low-fat dairy, healthy fat, and low sodium. Now, sodium is the most important thing for hypertension. And if you look at, I will show you one slide about sodium. Our daily recommendation is we should take either 2,300 milligram per day. American Heart Association said 1,500 milligram, but on an average, we are taking almost double than what is recommended. And remember, 1 teaspoon is 2,300 milligram. So many times we don't pay attention to the sodium. Sodium is the single culprit for hypertension. So if we are in a habit of adding more salt to the food, we should look into our blood pressure to make sure that is not the cause. Too much sodium is very dangerous. So just like DASH diet, there's another diet called Mediterranean diet. Again, in the studies, it has been seen it reduces the stroke risk by 20 to 30%. And it is a traditional eating plan of countries bordering the Mediterranean Sea, such as Greece, Italy, and Spain. And it focuses on whole, minimally processed food, emphasizing healthy fats, fresh produce, and lean proteins, with emphasis on overall lifestyle. So again, these are the main components of this Mediterranean diet. You can go to any good resource and read about it. One of the things a lot of people are following either of these two diets these days. So what are the other risk factors? Diabetes. Again, diabetes not only increases the risk of stroke, but it also makes treatment more difficult. For example, aspirin does not seem to work as well in diabetic as in others. So we prefer to give clopidogrel or Plavix in those patients. It has been seen people have approximately twice the risk of stroke in diabetic as compared to without diabetes. Now, also, it has more risk in women than in men with diabetes. So what is the goal? We want to keep our hemoglobin 1AC value of less than 7%. Ideally, maybe 6.5 or less. Again, this is achievable with diet and exercise, so please, and medication. If you have a diabetes, making sure you pay attention to this number, hemoglobin 1AC, and try to keep it around 6.5 or 7. Now, second is carotid or any other artery disease. Now, carotid stenosis, up to 60% is okay, but if it's more than 60, you have higher chances of stroke. Now, we want to make sure you see your neurologist or vascular doctor, and then they do carotid ultrasound every 3 to 6 months. Keep an eye on it. And the interventions are medications. And if it grows to 80% or 90%, the surgery is another option. Another risk factor is something called irregular heartbeat or atrial fibrillation. Very, very common. About 40% of the patient where we don't find any cause for stroke, we call cryptogenic strokes. The culprit is undetected atrial fibrillation. In fact, your latest Apple Watch has a feature to detect atrial fibrillation. Now, it leads to the formation of small clots in the heart chambers that can travel to the brain and cause a stroke. Most patients with this heart rhythm benefit from Coumadin or newer oral anticoagulant. Now, if you look at the literature, atrial fibrillation, if you have atrial fibrillation, you increase stroke risk by at least 5-fold or more. So very important, if you have AFib, you talk to your primary doc, get evaluated whether you need a stronger blood thinner. Other heart disease like mechanical valves, certain blood disorder, excessive alcohol use, illegal drugs, they all increase stroke. Now, high cholesterol is also one of the independent risk factors. And you must have seen, everybody who has stroke or heart disease, we put them on statin. This is particularly help to decrease the LDL level, which is a bad cholesterol. So our goals typically are total cholesterol should be less than 200, LDL less than 70, HDL greater than 40, and triglyceride less than 150. So if your numbers are not in that, please talk to your primary doc. And last but not the least, one of the things is sleep apnea. 90% patients with sleep apnea, they are undiagnosed. And what are the cardinal symptoms? Snoring. Snoring with pauses in breathing, frequent arousals at night. I mean, you wake up, you don't feel fresh. You can have dizziness or you can have a headache when you wake up. And during daytime, you feel like very sleepy and tired. And when we do a sleep study, by the way, we can do 2 types of sleep studies these days, home sleep study or in lab sleep study. And both have their advantages and disadvantages. But home sleep study is not bad as compared to in-lab sleep study for majority of the population. And we can pick up a lot of patients that way. Now, if you have moderate to severe sleep apnea, it may contribute to our cause first time or recurrent stroke. So very, very important. We don't miss this. And then every other patient with stroke will have sleep apnea. Everybody who has a stroke, we screen them for sleep apnea with a home device. And if they're positive, we treat it. That decreases their chances of subsequent strokes. No, those were medical. No, the next risk factors for stroke, which we can prevent, is our lifestyle. And this also plays a big role. Now, when we say lifestyle, there are 5 choices which will help us a lot. Tobacco. When people smoke, the nicotine and carbon monoxide in tobacco does not reduce the amount of oxygen in the blood, but damage the inside of the blood vessels. So smokers have 2 to 4 times increased risk of stroke. The only treatment for it is we need to stop it. No to smoking, no to vaping. Second, physical inactivity and obesity. Recommendation is BMI should be less than 25. Physical activity at least 30 minutes each day, up to 150 minutes per week. Moderate to vigorous intensity physical activity. It can be just brisk walking, walking with a little bit of weights. But again, that's minimum. You can do more, but at least that will help. Now, one other big issue is sleep. We need to sleep enough for our body to be recharged and also mind to get rest. And most adults, they need 7 to 9 hours of sleep, although there are few exceptions. So we need to make sure we have adequate sleep to prevent the strokes. And also, if you have sleep apnea, we use CPAP or oral device or other interventions. Now, one other factor which affects a lot of people is alcohol. Heavy drinking can increase your risk of stroke. So recommendation is 0 alcohol, but if you still have to drink it, 2 drinks per day for men and no more than 1 drink per day for non-pregnant women. Pregnant people should not drink alcohol. And last but not the least, we already talked about eat a healthy diet. It should be rich in fresh fruit, vegetables, and whole grains. Cooking in non-tropical oils such as olive and canola. Include a variety of proteins, lean meat, fish, beans, tofu. If you're vegetarian, you can just have beans and tofu. Minimally processed food. And limit salt intake, limit intake of added sugar, avoid fried food. So in summary, stroke and TIA is a true medical emergency. Majority of the strokes are ischemic in nature, 87%. Call 911 if anybody has stroke-like symptoms. Remember, be fast or fast. Time is brain. Every minute, you can lose up to 2 million cells in the brain. Treatment window for stroke intervention has been increased up to 6 hours and in select cases up to 24 hours. We can reduce up to 80 to 90% risk of the stroke by modifying medical risk factors and healthy lifestyle changes. Thank you very much, and we can open up for any questions.
Thank you, Raj.
सचिन जी आपने इसको रिकॉर्ड किया है ना?
Yeah. So that just wait a second.
Okay.
Raj, you can remove the screen now.
Okay.
So that was pretty amazing presentation. This is very, very complex topic, but he simplified it so well for us. Now, obviously, there were a couple of questions, and you answered